We are going to nervous tissue, and I told about bone and cartilage, neural tissue also the cells and the stroma, and the stroma is called as neuropil. Probably I will put a proper color. They will be more reddish or pinkish. And cells, there are only 5 cells you have to know. One is motor neuron cells, neuronal cells or neurons. Second is astrocytes. Third is oligodendrocytes. Fourth is microglial cells. And what are microglial cells, Meryl?
The macrophages, sir.
Super. Microglial cells, and lastly ependymal cells. These are all the 5 cells you have to remember in neural tissue. And you know one more cell, it is not in the neural system, but within the skull is the meninges. So meningiocytes, probably 6 cells you have to see. And meningothelial cells are usually like flat cells, like a mesothelial cell. Neurons are very easy. They are nothing but ganglion cells. When the ganglion cells are situated in the brain, we call neuronal cells, but it is the other way. When the neuronal cells are situated in the periphery, we call them as ganglion cells. They will have like a plasma cell, plump cell, and they will have a vesicular nuclei, and they will have a prominent nucleoli. And more importantly, they will have nissal substance. Nissal substance will be more brownish granular material in the neural tissue. So this is a neuron. Astrocytes are the cells that are holding the background along with the neurophil. Astrocytes will be more like a kite-shaped cells, and they will have a lot of cell processes. And these neuronal cells may also will have cell processes. So this is the astrocyte. They will have more vesicular nuclei. They won't show any nucleoli. So that is astrocyte. And oligodendrocyte, they will look like lymphocyte. Just dark. You may not see the cytoplasm. It will be very scant. The whole cell will look like a lymphocyte. That is oligodendrocyte. And microglial cells, it's very hard to see them, but they will look like a macrophage. Kidney shaped nucleus with a moderate amount of cytoplasm. This you see mainly when there is a brain infarct and other things. Normally they are not seen that prominently. And lastly, ependymal cells, and you all know the brain doesn't have lymphatics, and that's replaced by cerebrospinal fluid in the ventricular system, and this ventricular system is lined by the ependymal cells, okay, and they will be sitting on the basement membrane, and they will be more cuboidal. And some areas they are thrown into papillary processes. They are nothing but choroid plexus, okay, and the choroid plexus, you all know, that secretes the cerebrospinal fluid. As I told you, it will be more like a papillary process, and it will have ependymal cells, and these ependymal cells will be single layered. If it is more than one layer, then it is choroid papillary neoplasms, papilloma and papillary carcinoma. So it's very important to differentiate choroid plexus from papilloma and papillary carcinoma. But the main thing you have to remember, a normal choroid plexus is single layer of cuboidal cells. CNS tissue is divided into gray matter and white matter. The neuronal cells are seen only in the gray matter, whereas white matter will have the axonal processes, astrocytes, oligodendrocytes, microglial cells, whereas you never see the neuronal cells in the white matter. That is a very important thing I forgot to mention. No neuronal cells in the white matter. They are seen only in the gray matter. And another thing, whenever you see brain biopsy, if it is normal, it is heterogeneous made up of all these five types of cells. Whereas when in malignancy, you see only one type of cell, homogeneous.
Spinal cord, anterior gray horn, motor neuron, and adjacent white matter, stain H&E, medium magnification. From the on the top, they have divided the left half into white matter and right half of into gray matter of anterior horn. Starting from the left, there are axons, multipolar motor neuron, plane of section missed nucleus, nissel substance, axon, hillock, and axon. And on the right, they have mentioned dendrites, multipolar motor neurons, nucleus and nucleus of multipolar neurons, and neuroglia.
Super. So can you see the difference between white and gray matter? What is the difference, Abjit?
Sir, yes, sir. In white matter, it is mostly the axons that are present,
Yes.
sir.
Neurons are never seen in white matter. And what do you understand by number 2? Multipolar motor neuron cells, plane of section missed the nucleus. What do you understand?
Sir, the cell body, because it's very large, abundant cytoplasm, the nucleus is in the lower plane, sir.
Yeah. No, nucleus is in a plane where we are not seen because it is not seen in this cut. Probably when you go deeper, nucleus will start coming. Do you understand?
Yes,
It's
sir.
like a egg yellow. You may not see the egg yellow when you cut the periphery of the egg, but the deeper you go, you start seeing the egg of the yellow of the egg, isn't it?
Motor neurons, anterior horn of spinal cord, stain hematophyll and eosin, high magnification. First one is on the right side is arteriole. Next is nuclei of the neuroglia. Third is capillary. Next is missile bodies. Fifth is axon. Sixth is axon hillock. Seventh is the motor neuron. Eighth is again missile bodies. 9 is nuclei of the neuroglia. 10 is dendrite. 11 is nucleus. And 12 is nucleolus. 13 is axon hillock. 14 is axon. 15 is venule. 16 is again dendrites.
Super. Here I want to concentrate on the motor neuronal cells that are having multiple dendrites and prominent nucleoli in the vesicular nuclei, and see the nissel substance. Usually they will be bluish or brownish, but don't give importance to the color. But when you see some pigments with a prominent nucleoli with multiple dendritic processes, that's how motor neurons will look. Super. There is no need to read the next one. I think it's a silver stain. That's why it's looking like that. Silver stain, the neuron and neuronal processes will be black in color.
Apical dendrite of pyramidal cells, neuroglial cells, pyramidal cells with nucleus and nucleolus, axon of pyramidal cells, venules, capillary, apical dendrites of pyramidal cells, neuroglial cells, neurofibrils, and axon of pyramidal cells.
Super. You understand, Manav? And see, I forgot to mention about the neurophil in the background. Even we can go to the previous thing and see. This is the neurophil. I told you, no, it is fibrillary pink material. Can you all see it? These are all the neurophil. Coming to cerebellum, there is one more layer here. It's gray matter, white, rather than gray and white matter. This is granular layer and molecular layer, and in between the granular layer and molecular layer we see the Purkinje cells, and these Purkinje cells are nothing but they will exactly look like motor neuronal cells. I think the next picture will show you this one. This is the molecular cell layer. Okay, that's 6. Then the Purkinje. Then number 4 paranga, granular cell layer. So the gray matter itself is having 3 layers. Outer molecular layer, which is more neurofibrillary, Purkinje cell layer where you see flask-shaped cells, and then granular cell layer where you see granular cells that are more looking like lymphocytes, and then comes the white matter. You have to remember 6, 7, 4, 5 in that order. Molecular, Purkinje cell, granular cell layer, white matter.
First, we have a molecular layer, and then Purkinje layer, granular cell layer, and then we have white matter. In molecular cell layer, we have basket cells, dendrites of Purkinje cells, And in Purkinje layer, we are having Purkinje cells with nucleus and nucleolus.
Okay.
And in a granular layer, we are having Golgi type 2 cells, granule cells, and glomeruli. And in white matter, we are having axons.
Next.
Oligodendrocytes of the brain, stain, silver impregnation, Cajal's method, medium magnification. Oligodendrocyte, neuron, fibrous astrocyte, oligodendrocyte again, capillary, neuron, oligodendrocyte.
These are like peripheral nerves. As I told you, the nerves will have what type of nucleus? Kitana. Yes, wavy nucleus. Let us see the neural tissue, peripheral nerve and blood vessels and all we have seen. Hereafter it is more like revision.
Peripheral nerves and blood vessels, transverse section, stain H&E, medium magnification. From the left, we have nerve fascicles, nuclei of Schwann cells, myelinated axons, fibrocytes, perineurium with fibrocytes,
Very
tunica
good.
media of arteriole,
Very
internal
good.
elastic membrane, the connective tissue, adipose cells, venules, and arteriole again.
So, as I told you, in the periphery also we have extension of the gray matter, okay, and that we call it as ganglion cells, and this is the dorsal root ganglion.
Dorsal root ganglion with dorsal and ventral root, spinal nerve, longitudinal segment, metaphyseal neurons. One is the connective tissue layer with the blood vessels. Number 2 is unipolar neurons of dorsal root ganglion. Nerve vesicles. Fourth is epineuron of the spinal nerve. Fifth is the spinal nerve. Nerves and blood vessels in connective tissue layer. Seventh is the dorsal root ganglion posterior. Eighth is arachnoid of the dorsal root. 9 is dorsal nerve root. 10 is arachnoid sheath of the ventral root. 11 is ventral nerve. Cells and unipolar neurons of dorsal root ganglion, stain, hematoxin and eosin, high magnification. Unipolar neuron, at the nucleus and the nucleolus is seen and it is surrounded by cytoplasm. 2 is fibrocytes. 3 is the satellite cells. 4 is cytoplasm of the neurons. 5 is myelinated axons. 6 is the unipolar neuron. 7 is capsule cells. 8 is the satellite cells. And 9 is the lipofuscin pigment. 10 is myelinated axon. 11 is Schwann cells.
Overview of figure 8. Comparison of a muscular artery, a large vein, and the 3 types of capillaries, transverse section. So, large vein, there is valve, endothelium and subendothelial layer making up the tunica intima, and then tunica media and outermost tunica adventitia. And in tunica adventitia, we can see the nerve and vasa vasorum piercing it.
Yes.
And muscular artery, starting from the innermost endothelial, subendothelial layer and internal elastic lamina forming the tunica intima, and smooth muscle, elastic fibers and external elastic lamina forming the tunica media, and outermost tunica adventitia pierced by nerve and vasa vasorum. And below we have 3 capillaries, sinusoidal, that is a discontinuous capillary, and then fenestrated capillary with fenestrae and continuous capillary, and we see a nucleus of a cell there.
What cell is that?
Endothelium, sir.
Super, but practically it's difficult to differentiate sinusoidal, fenestrated and continuous capillaries. So we just call them capillaries. And before that, you see the difference between the vein and the artery. I don't know why they have not put one elastic lamina in the vein. You have to include it. And another very important learning point is here, the one you called as vasa vasorum. Why it is important? Meryl, do you have any idea?
Vessels of the vessel, sir. They supply the blood vessels.
Okay. Why the blood vessels are having so much blood in the lumen? Why do they have another vessel? You are correct. Whatever may be the blood cells here, they cannot eat
reach
or
the
yes,
outermost
cannot
layers.
get the nutrients. Not most layers, even the endothelium cannot get anything from the inside blood vessel. This vasa vasorum is the one that is supplying the arteries. If the vasa vasorum and the veins, if the vasa vasorum is destroyed, then you will have necrosis of that particular blood vessel. There may be a lot of blood inside the vessel, but when the vasa vasorum in the adventitia is gone, the blood vessel is gone. And what is the disease that affect the vasa vasorum? If you remember the disease, it's very easy to apply. Have you all heard of syphilis?
Yes, sir.
Syphilis affects vasa vasorum. That's why it produces a weakening of the arteries and produce aneurysms. Remember, the ascending artery aortic aneurysms are very common in syphilis because of the effect in the vasa vasorum.
Figure
Subha,
8.1, blood and lymphatic vessels in the connective tissue. Stain hematoxylin using on low magnification. We are seeing in nerves and transverse section, arterioles, small artery, tunica intima, which has endothelium, subendothelial connective tissues, internal elastic lamina, and then outer tunica media and tunica adventitia, surrounded by vasa vasorum.
Super.
And then we are having an arteriole on oblique and longitudinal sections, venules on oblique section. We are seeing capillaries on longitudinal and transverse section. And we are seeing a small vein which having endothelium, tunica media and tunica adventitia. We are seeing lymphatic vessel also on transverse and longitudinal sections. And valves of lymphatic vessels in and lastly adipose vessels.
Valves can be seen in addition to lymphatics. What other vessel can have valves, Subha?
Veins also have valves.
Yes, okay, veins and lymphatics. And can you see the difference between artery and the lymphatics? What is the main difference here, Subha?
In our artery, we are not having valves, and that consists of muscles and two elastic lamina we are seeing here. And in veins, we have valves, and the muscle layer are very less, and only one elastic lamina is using.
No, in lymphatics.
In lymphatics, we are seeing only valves, sir, and there will be no RBC and all, only lymphatic fluid will be present.
Yes, that point is very, very important. No RBC. It is having some fluid and some lymphocytes. It's a lymphatic fluid that looks like more pinkish. It's lymphatics. Whereas here, arteries and veins will have RBCs. That you have to remember. In case of lymphangioma, they are dilated blood vessels without any RBC, lot of lymphatics. Whereas in hemangioma, it's dilated increased number of blood vessels with a lot of RBCs there. That is very, very important.
Muscular artery and vein transverse section, stain, elastic stain, low magnification. Artery, internal elastic lamina membrane, tunica media with elastic fibers, external elastic lamina, tunica adventitia, collagen fibers, elastic fibers.
Super.
Vein, tunica intima, tunica media, tunica adventitia, capillary, venule, arteriole, adipose tissue. Artery and vein and dense irregular connective tissue of vast difference. Stain, iron, hematoxylin and Alcian blue. Small artery, tunica intima, consisting of endothelium, subendothelial connective tissue, internal elastic lamina membrane. Tunica media, tunica adventitia, connective tissue. Small vein, tunica intima, endothelium, tunica media, tunica adventitia.
Wall of a large elastic artery, aorta, transverse section, stain, elastic stain, low magnification. From the left, endothelium, subendothelial connective tissue, internal elastic lamina membrane, elastic fibers, connective tissue, vasa vasorum, venule and arterioles, then smooth muscle fibers, circular, and lastly venule. And below they have divided the layers, the innermost being tunica intima, middle tunica media, and outermost tunica adventitia. wall of a large vein, portal vein transverse section, stain HND, low magnification. Once again divided into tunica intima, tunica media, and tunica adventitia. Starting from left, we have endothelium, subendothelial connective tissue, smooth muscle fibers circular, then smooth muscle fibers in bundles which are in longitudinal section, vasa vasorum which show arteriole, venules, and capillary.
Atherosclerosis, it is a eccentric disease. This is lumen, the atheroma will be like this. This is atherosclerosis. It's an eccentric disease. Whereas in Monkey-Burke's median calcification, this is the medium, it's a concentric disease. The calcification is seen throughout the wall in the media. It's a concentric, that you have to remember. Eccentric and concentric lesion. This is Monkey-Burke's. Now we are coming to the heart. Let us read about it, and then its heart is nothing but a modified blood vessel.
Figure 8.6, heart, a section of left atrium, atrioventricular valve and a left ventricle, longitudinal section, stain hematoxylin and eosin, low magnification. 1 is the endocardium of the atrium, 2 is the subendocardial connective tissue, 3 is the myocardium of the atrium, 4 is annulus fibrous, 5 is cusps of the atrioventricular valve, the mitral valve, 6 is the endocardium, 7 is the connective tissue core, 8 is chorda tendineae, 9 is endocardium of the ventricle, 10 is trabeculae carneae, 11 is the papillary muscle, 12 is coronary artery, 13 is epicardium of the atrium, 14 coronary sinuses and valve of the coronary vein, 15 is adipose tissue and coronary vein, 16 is the epicardium of the ventricle, 17 subepicardial connective tissue, 18 Purkinje fibers, 19 myocardium of the ventricle.
So even though you see 19, you have to remember mainly 5. One is endocardium, 2 is myocardium. Okay, even here I can put 2 as a myocardium, and 3 is the epicardium. It has 3 layers: endocardium, myocardium, and epicardium. If the disease is affecting all the 3 layers, then only we will call it as pancardium. Rheumatic heart disease is pancarditis. It involves endocardium, myocardium, and epicardium. And then in the epicardium, and myocardium and epicardium has some connective tissue beneath it, that is known as subendocardial connective tissue and subepicardial connective tissue. And this subepicardial connective tissue has the main structures: coronary arteries and coronary veins. If you remember these 5, that will be more than endocardium, myocardium, epicardium. The endocardium and epicardium has the subendocardial and subepicardial adipose tissue or connective tissue. And in the subepicardial connective tissue, we have coronary arteries and coronary vein. And this is the basic understanding. But in the valvular level, for example, this they mention left atrium. So this should be mitral valve. And mitral valve will have same epicardium, the endocardium, small muscle bundles coming there, right, myocardium. And you may not see any epicardium in the valve. And you may see some papillary muscles, and which may be getting connected with the valve to open and close it. So that's the basic. And the myocardium, you know the muscle bundles. We will see it probably high power in the next picture.
Figure 8.7. Heart, a section of right ventricle, pulmonary trunk and pulmonary wall, longitudinal section, stain HNE, low magnification. Epicardium and subepicardial connective tissue and adipose tissue, showing the coronary arterioles and venules. And then the inner myocardium. And we also see the
not
pulmonary
inner. You have to say middle myocardium. Okay?
Middle
not
myocardium. Middle myocardium. And then we see the pulmonary trunk divided into tunica intima, tunica media, tunica adventitia, and endocardium of semilunar or pulmonary valve with the connective tissue core, annulus fibrosus, and endocardium of right ventricle.
I told you, you have to remember 5 things. 1 is endocardium, 2 is myocardium, 3 is the epicardium, 4 is the connective tissue between the epicardium and endocardium, subendocardial and subepichondrial adipose tissue, that is 4. And 5 is the blood vessels that are traveling in the epicardium. And you hardly see whole heart biopsy. What will happen if they take the whole heart biopsy? Cardiac tamponade, okay, they will die. So whatever they take, they usually take it from the right ventricle, because they go through the venous system to the right atrium to the right ventricle, and I will remove this one. So what biopsy you usually see in pathology is the endocardial biopsy or endomyocardial biopsy. So that's they take like this, or they take like this. If you get a biopsy like this with the major blood vessels and subepicardial adipose tissue, you have to call the clinician immediately and tell them, I see the full thickness of the cardiac wall, please check. And before you tell, patient may be in a very critical situation. They may be knowing it, but it's better to tell them whenever you see. There is something called panic value. Have you heard of it, Meryl? Panic value in pathology?
No, sir.
These are all the findings. You call them immediately, the clinicians. One of the best example is ectopic pregnancy. Okay, you have to call them immediately. The patient may have intraperitoneal bleed and death may be thick. These panic values are very critical findings, which we have to, or the other better name we have to use is critical value. Why panic value? You should not get panic. Critical value. These are all the critical findings which you have to immediately call the clinicians and tell them.